system, internal capsule is the most important part. And these are the two lectures which will be included in the next quiz, motor system. Please remember internal capsule, you already know that these are the cortical nuclear fibers which collect in the cerebrum. What is the definition? Internal capsule, it is a V-shaped band of fibers between head of the cardiac nucleus, thalamus and lentiform nucleus. Remember that this is the place, this is the internal capsule. If you go inside the cerebrum, there are three big masses. This is cardiac nucleus, I told you before. Lentiform nucleus like lens, it is lateral, L. This is medial. L you remember, lateral, this side is lateral, lentiform like a lens. Cardiac nucleus, this is thalamus. There are three big grey matter. Mass in the cerebrum. And here you will find all this filled by fibers. This is called internal capsule. Internal capsule. What are the parts? Internal capsule has an anterior limb, genu, posterior limb. Anterior limb, genu, bent, posterior limb, two other parts, sublenticular below and retrolenticular behind. Sublenticular, and so there are thumbs up. 5 parts of the internal capsule. 5 parts of the internal capsule. You know what is internal capsule? It is a band of fibers. It is a collected fibers. Okay? Where is it located? Where present? In the cerebrum, between the cardiac nucleus, thalamus on the medial side, lentiform nucleus on the lateral side. Sometimes you should be clear about the location. It has 5 parts, anterior limb, between the cardiac nucleus and lentiform. Genu means bend. Posterior limb, sublenticular part and retrolenticular part. Again showing the parts of the internal capsule. Anterior limb, here will be the cardiac nucleus, here the lentiform nucleus. Anterior limb, genu, posterior limb, sublenticular part and retrolenticular part. No, this is just showing the part diagrammatically to show you the parts. Why you should know the parts? Because the different fibers pass through the different part. Okay? If there is a hemorrhage in the anterior limb, different fibers will be damaged. If there is a hemorrhage, bleeding in the region of genu, different fibers. If there is a bleeding in the posterior limb region, different fibers. That is why you should know what are the main important fibers passing through each one of them. This is again the same. This is the cardiac nucleus, medially lentiform nucleus, thalamus. These two on the medial side. Lenti, L, lateral. And this is the anterior limb, this is the posterior limb, this is the genu. This is the position in the cerebrum. If you make a longitudinal section, horizontal section of the cerebrum, there are some structures you should always remember. Please remember, very important for your examination, for your clinical years. This section, some structures you should always remember. I told you about this when from the motor area fibers called corona radiata, and below when they are collected it is called internal capsule. Here, this is the region of internal capsule: anterior limb, posterior limb, sublenticular, retrolenticular part. This is the cardiac nucleus, lentiform nucleus, thalamus. This is the corpus callosum. Cut. Corpus callosum. Below the corpus callosum there is a septum. Septum pellucidum. And attached to the lower part of the septum pellucidum, it has two layers. Septum pellucidum has two layers. And attached to the lower border is another fiber called fornix. Fornix. So please remember these names of these structures.
Can you repeat it?
Yeah, this is the corpus callosum. I have written here corpus callosum. Below this there is a septum, double layers, and below the septum there is fornix. Then on the lateral here you have caudate nucleus, big gray matter, thalamus, another gray matter, caudate nucleus, and lentiform nucleus, another gray matter. In between there is internal capsule area. Lateral to the lentiform nucleus. Lateral to the lentiform nucleus, there is another gray matter, strip. Yes, this is called claustrum. This is called claustrum. This I want to show you. This is the actual picture of the brain, same as I showed you before. You can see here, this is the caudate nucleus, this is the thalamus, this is the lentiform nucleus, and this up here, white here is the internal capsule. Anterior limb, posterior limb, and genome. Then sublenticular and retrolenticular parts. So these are the parts. This is the corpus callosum. This is the septum pellucidum. This is the claustrum. Claustrum on the lateral side. So please remember the names of these structures which are located, and this is actually looking like this. If you cut a brain section like this, it will have the appearance. The last part is what are the fibers? I told you before. What are the fibers in each part? You know, in term capsule khamsa part.
Yes.
Anterior limb. Which fiber pass through the anterior? Genome. Which fiber pass through? There is a list, but I want you to remember only one from each part. Only one. I will be happy if you remember one. Okay? This, from the anterior limb, you have anterior thalamic radiation. Any fibers going to the thalamus. From the genome area, you have cortico-nuclear. Suppose there is a bleeding, hemorrhage in the region of genome. Which fiber will be affected? Cranial nerve, corticonuclear. From the posterior limb, pyramidal or cortico-spinal. This is the main. Other smaller are corticopontine, corticocerebral, superior thalamic, and fibers from GP to the subthalamic nucleus. These are all smaller group, but the main is cortico-spinal, motor fibers for the body. Yes? I will talk to you in one minute. Let me finish this. Retrolenticular, posterior thalamic fibers or optic radiation. So if there is a hemorrhage in the retrolenticular part, the vision will be affected. Similarly, sublenticular part, auditory radiation. If there is a bleeding damage in this area, hearing will be affected or lost. These are 5. I remember you one important from each one of them. Please remember one important from each one of them. That's now the last part is this. You know, this is as I told you that internal capsule is a very important area. Why? There are many fibers are collected. If there is a small damage, there is more fibers will be affected. And by incidentally, this is the commonest area where there is a hemorrhage takes place. There is a small artery, very fine, a small artery go inside the brain. Go inside the brain. And sometimes this artery ruptures, especially in the patient who are old, who have a history of hypertension or high blood pressure. Sometimes, and especially in the ventures, this artery breaks and it causes the bleeding, what is known as intracerebral hemorrhage or the bleeding inside, and it damages the internal capsule. You have a patient who is about 60 years or above, 60, 70 years, who is normal, but he has a history of hypertension, and he is normal, but sometimes he falls down suddenly, becomes unconscious, and when you examine, half of the body is paralyzed. This is a case of brain hemorrhage. What normally we call it in English, but it is actually the hemorrhage inside the cerebrum. Intracerebral hemorrhage. Intracerebral hemorrhage. Hemorrhage in the region of internal capsule. 90%, more than that, it will be a case of hemorrhage in the region of internal capsule. And there's a lot of treatment for it. If you go to the neurology ward, you find many patients with hemiplegia. Half of the body is paralyzed. And if the hemorrhage, as I told you, hemorrhage on the left side, body is affected on the right side. And if there is a hemorrhage on the right side, the body is affected on the left side. This is a typical case of hemorrhage in the region of internal capsule, what we call intracerebral hemorrhage. You can see this is the bleeding area, this is the corpus callosum, this is the thalamus, caudate nucleus, tensiform nucleus, and this is the region of internal capsule, and here there is bleeding. This is affected here, the cross section. Okay. Now there are many ways where you can actually by MRI, now new investigations have come, you can exactly spot out how much is the hemorrhage, where is the hemorrhage, and you can treat accordingly. Thank you very much. Please remember, before we leave, I want to tell you that please remember the concept of what is upper motor neuron, what is lower motor neuron, what is pyramidal, what is extrapyramidal, what are the nuclei of extrapyramidal, what are the tracts of extrapyramidal, and about the pyramidal tracts, how the fiber arise, how they go, and where they end in this part. The second is the internal capsule, the details.